Good morning, everyone following in North America. Good afternoon for those of us joining in Africa. My name is Damon Wilson. I'm the Executive Vice President of the Atlantic Council. I'm delighted to welcome you to this discussion with Dr. John Nkengasong, Director of the Africa Centers for Disease Control and Prevention, and the Honorable Jessie Le Pen, U.S. Ambassador to the African Union. Dr. Nkengasong, Ambassador Le Pen, thank you both for being with us today.
Thank you.
Welcome.
It's a pleasure
welcome.
to be on this discussion with you.
We're gathered amid this pandemic because we're here to discuss the response of African countries and institutions, and in particular, the Africa CDC, a specialized technical body of the African Union that was created in 2016 in response to the 2014-16 Ebola outbreak. That pandemic, which claimed over 11,000 lives in West Africa, highlighted the need for a continental coordination effort that encompasses prevention, surveillance, and response. Rising to this challenge, the Africa CDC has been tested by the outbreaks of Ebola in the Democratic Republic of Congo and Lassa fever in Nigeria. Even before the first case of coronavirus was reported in Africa, the Africa CDC snapped into action and has since served as the forefront of the continent's response to conduct emergency meetings for health ministers, publish strategy documents, and create a task force that pulls from Africa's talented public health specialists. But in this pandemic, the Africa CDC faces its biggest challenge yet. While the virus was initially slow to spread across African countries, the continent is expected to be hard hit in the coming months, producing what you, Dr. Nkengasong, have referred to as an existential threat. Many African communities are incapable of implementing social distance measures. They have little access or no access to clean water for hand washing. Some lack sufficient social safety nets and face considerable resource constraints. So it's in this context that the position of the Africa CDC has never been more important, and the U.S. ability to support the organization will be vital in ensuring a fully leveraged response. So I want to remind everyone that this conversation is on the record. You can follow us on Twitter at AC Africa Center. You can ask your questions using the hashtag Corona Africa. For those of you who are joining us on Zoom, you can use the Q&A function at the bottom of your screen, toggle over the Q&A, enter your Q&A there, and we'll be able to moderate that question for our guests. I want to give a shout out to our Africa Center team that's led by Bronwyn Bruton, Luke Typersky, and Alyssa Harvey, who are with us today. But once again, a real special thanks to Dr. Nkengasong and to Ambassador Le Pen for being here to speak with us. I'm going to turn over the show to Cameron Hudson, a senior fellow with the Atlantic Council's Africa Center, who will moderate this discussion. Over to you, Cameron.
Damon, thanks very much. And again, I echo your welcome of our two panelists. I'm just thrilled that we have such distinguished panelists here to tackle what is a very timely and important conversation. I just want to give my own welcome to everyone and note that Africa in the last few weeks has seen a 43% increase in COVID-19 cases across the continent, bringing the caseload to over 33,000 people, with deaths already in the range of 1,500. This comes on the top of a very grim warning from the WHO recently that warned that more than 300,000 Africans could be killed by the virus this year and another 30 million pushed into extreme poverty. So it's already been said that this really does represent an existential threat to the continent, and I think presents far-reaching policy implications for the United States and the world. So I can think of no better panelists to help us address and unpack these issues than our two guests today, who I want to introduce very, very briefly for you. First, Dr. John Nkengasong. He is the director of the Africa Centers for Disease Control and Prevention. Previously, he served as the Associate Director for Laboratory Science and Chief of the International Laboratory Branch at the US CDC in Atlanta, Georgia, where he worked for 2 decades. In addition, Dr. Nkengasong co-chairs the US President's Emergency Plan for AIDS Relief Laboratory Technical Working Group and serves as the founding chair of the Board of Directors for the African Society for Laboratory Medicine. Dr. John, thank you so much for joining us today. Ambassador Le Pen serves as the current U.S. Ambassador to the African Union and the U.S. Permanent Representative to the United Nations Economic Commission for Africa. A few of her many roles in a distinguished career include serving as the Chargé d'Affaires at the U.S. Mission in South Africa from 2016 to 2019, the Chief of Staff to the Undersecretary of State for Civilian Security, Democracy, and Human Rights, and Deputy Chief of Mission at the U.S. Embassy in Kigali, Rwanda. Thank you both for joining us today. Dr. Nkengasong, I would like to start with you, if I could, and ask you to help us set the scene a little bit for the conversation we're going to have today. First, by helping our attendees get better acquainted with the Africa CDC, which is still a young organization, and help us understand the roles and responsibilities it plays in responding to COVID-19 right now, and then also give us a sense of what your top priorities are as you enter into really the most dire phase of this pandemic in Africa. So thank you.
Thank you. Thank you so much. I mean, as you rightly indicated, the Africa Centers for Disease Control and Prevention is a relatively new public health agency, a specialized technical institution of the African Union, which went into operations on the 31st of January 2017. And as you said in your introductory remarks, the creation of Africa CDC, or the coming to life of Africa CDC, was accelerated because of the Ebola outbreak that occurred massively in West Africa, resulting, unfortunately, to the loss of about 11,000 lives. So the Africa CDC's existence is actually the wisdom and the vision of the head of states of the continent. And if I can just use that as a segue to address the COVID-19 challenges or a pandemic that we are facing on the continent. As indicated, as of today, the continent has reported about 33,000 cases from 52 member states across the continent, and about 1,500 people have unfortunately died. I think if you put this in the context of the world, we are facing an unprecedented threat. I'm a practicing virologist for the last 31 years, and there's nothing in my practice for over those years that can even remotely remind me of such a dreadful, fast-evolving, very, very vicious virus as the COVID-19, which has the ability to disrupt, move quickly, and kill and infect this large number of people. So I use this statement to say that this is really a global health crisis that requires global solutions and global solidarity to address it, especially on the continent of Africa, where we have limited resources. If you look at further, you push our analysis a little bit further, there are 4 countries that bear the greatest burden on the continent of Africa for COVID. That would be South Africa, with currently about 4,500 cases. Egypt has a similar number of cases. Morocco, also 4,000, and then Algeria, 3,300. I say this to make a point that these are countries that have something in common, that in the past 4 weeks or so, they have seen almost a 500% increase just over the last 5 weeks there, those countries. And I think that's very important. I say this to make a point that people begin to read in papers that where Africa might have been spared this outbreak. I don't think so. I think we are early on in the outbreak, the pandemic, and we have to continue to prepare actively there. There are a series of probably the main reason these countries are showing a large number because they've increased their testing. One of the greatest challenge we have in our response strategy for this pandemic on the continent of Africa is testing. I'll just give you some numbers there. Algeria is testing about 105 tests per million. Morocco, about 455 tests per million. Egypt, about 560 tests per million. And South Africa, about 2,000 tests per million. I think we need to ramp that up and to scale. And that's why we've launched really an initiative called the Partnership to Accelerate COVID-19 testing on the continent, which aims to do a couple of things. One, to increase that number quickly, the number of tests on the continent to about 10 million in the next 3 months to 4 months, to establish a pooling mechanisms where we can work with countries to have access to diagnostics, to actually have deployed about 1 million health workers, not necessarily healthcare workers, but health workers that will assist in the contact tracing. That we entitled this initiative the Tracking, the testing and the tracing initiative there. And we will require all these elements to make it succeed. If we do that, then we continue to have a chance that we can detect individuals, isolate them, do the contact tracing, the basic things that are the cornerstones of what we call standard shoe-leather epidemiology, which is a cornerstone of what we should be doing at the continent now, so that we tilt the balance towards against the 3 million deaths that are projected or predicted on the continent. It also allowed us to have a system to understand when to reopen our economies, because our systems, as we say, are dying. The economic threat of this is already huge. The economic impact, of this is already huge for our continent there. And lastly, to do this successfully, we really need effective partnerships. Partnerships with the community. This will be economic. To win this battle, it has to be a community-led response and a community leadership response there. We need partnership with our traditional leaders, traditional allies like the United States and others. We need partnership with the multilaterals as much as possible, so that the continent can have a fighting chance against this. So I'm excited to discuss these aspects of the pandemic on the continent as much as possible. Again, thank you for giving me the opportunity to have this dialogue.
Thank you so much, Doctor. I want to bring Ambassador Le Pen into the conversation with us as well. And you've actually given me a nice entry to do that in talking about partnerships, because I wanted to ask the ambassador. I mean, this is a unique situation. Oftentimes, when there are crises in Africa, Africa is very much alone in dealing with it, whether it's a humanitarian crisis or a civil conflict, or even a pandemic like we saw previously. But this is a crisis that affects us in the United States as well, and affects every other country in the world. And so, can you talk to us a little bit about how, at a time of great need in the United States, it remains incredibly important to support African partners like the Africa CDC, and what the policy priority is for supporting organizations like this to combat the pandemic in Africa?
Absolutely. Thanks. First, thanks, Cameron, for convening. Thanks, Damon and the Atlantic Council, and thanks to Dr. John, who has really been leading Africa CDC in an extraordinary way through an extraordinary time. The starting point for partnership is for me a great place to start. I think your point that we are in our own challenging crisis while we're supporting others couldn't be more resonant for me and my team, who are, though in Addis, working from home. And some of our colleagues have in fact gone back to the US for health reasons. So we really are speaking from a place of shared challenge. The relationship between the US government and Africa CDC is longstanding. We've been there since the beginning in 2016, which I think gives us an excellent basis for partnership to address this current crisis. In many ways, Africa CDC was modeled on the US CDC, and our support for Africa CDC has been pretty similar, I would say, to the kinds of support we provide bilaterally to national institutes of public health. Until now, the focus has very much been in the technical space. So surveillance, labs, epidemiology. It's been a mix of providing basically technical assistance, in some cases through people, through actually posting colleagues to Addis. In other cases, we also provide assistance to partner organizations of Africa CDC, which basically gives staff support or surge capacity. That was true for Ebola, that's true for COVID, and we're looking at increasing that. I would contextualize, though, the Africa CDC support in the larger public health assistance for Africa, because it's hugely important, but the bulk of our assistance is and has been given bilaterally. So over the last 20 years, it's been over $60 billion. Obviously, the big piece of that is through PEPFAR, but also malaria, TB, monies to the Global Fund, influenza, and then epidemic response like Ebola. And in all those cases, a lot of the money has been bilaterally. But what I would say on that is, it also it's the funding, but it's also, from my experience, the people, right? That sounds obvious, but it is those people, whether USAID or CDC or State Department, who are then working abroad in public health, creating relationships, creating bodies of knowledge, and then building a basis from which to work now.
Great, thank you. I want to pivot to the very limited understanding I have of virology, and I risk even going into these complexities. But there seems to be a lot of misunderstanding, Dr. John, about how this virus is going to play out in Africa, and very simply, a question about whether or not COVID-19 will look differently in Africa, will infect and transmit differently in Africa than it has in the rest of the world. And I think if you look at the African media, there's a lot of hopefulness that because of Africa's relative youthful population with a median age of under 20 years old, and potentially hotter climate, that these could be mitigating factors to help Africa avoid some of the worst effects that we have seen in other parts of the world. Can you address some of these issues and help us to understand whether or not you think it will unfold differently in Africa than in other parts of the world?
Thank you. I think there are so many factors that we should be looking at on the continent here. And as the saying used to go in my previous life in HIV for almost 29 years, the saying used to be that know your epidemic. And I think we should extrapolate that to COVID-19, which is know your pandemic. There's common lessons that we are seeing, observing across. And again, as we analyze our data on the mortality and who is vulnerable, susceptible, will begin to image across the continent, will begin to appear, and that will allow us to know exactly how to target our efforts and resources to fight this global crisis or pandemic. Now, on the specifics, this is a virus that we know that it transmits very quickly, has a mortality, fatality rate of close to 7. And we've seen that in Africa, some countries, the mortality rate is way higher than that in some countries, and some countries, they are really below the global median. So I think we have some commonalities with what we are seeing in the West and China versus what we are seeing in Africa. The whole concept of the youthfulness of the population could be, and just could be, a factor that will play in our favor, because more than 70% or so of our population is less than 30 years old. We also have to, however, on the other side, look at the continent from the existing endemic challenges that we have, endemic diseases challenges that we have. For example, the huge burden of tuberculosis, HIV, and malaria. The combination of those three endemic diseases creates each year or leads to the death of about 1.2 million people on the continent. I think we have that. We also know that the continent as a whole is experiencing a new wave of non-communicable diseases in the areas of hypertension, diabetes, and others there. So I think, so we have those underlying diseases there on the continent, no doubt about that. So we truly don't know, as our projection or our pandemic or the outbreak increases, how this will play with our own underlying factors. There are severe cases of malnutrition across the board. We live in, because of our challenge situation, we live in rather crowded population in certain parts of the cities. So we just don't know when the virus seeds itself, as we are seeing, begin to see community transmission. We just don't know how the virus will spread. I think there are things we know, there are things we just don't know. We don't know whether this will remain a mild pandemic. Compared to what we are seeing in Europe and in the United States, We don't know if it's going to be a moderate outcome or if it's going to lead to a very severe outcome there. I think there's so many unknowns at this point, but we shouldn't. The message is we are in the morning of this pandemic. We may be delayed on the continent, but we need to continue to be extremely vigilant and do everything that is possible to put in place a basic and strong public health systems to fight it.
Thank you. I want to follow up on that because, as you suggested, there are many unique characteristics to the way this might play out in Africa, and Africa presents a couple of other, I think, unique policy challenges with respect to prevention. You have a number of what are called mega cities, right? So you have hundreds of millions of people living in extremely dense urban environments. Dadaab camp, refugee camp comes to mind, but also places like Kibera in Nairobi, which have very dense and very low levels of sanitation. Are there special precautions that you are thinking about for areas like that, which are really unique in the world? And then similarly, you have in Africa large and ungoverned spaces as well. So you go from the most urban and peri-urban to the most rural, and many of those rural areas are not necessarily under government control. And here I'm thinking of places in the Sahel, which might be either have very little government reach or might be under the control of other non-state actors. And so how have the conversations gone, or has there been any special attention paid to these two very different but very challenging parts of the continent that we think about from a policy perspective very often, but not always from a pandemic perspective?
Absolutely. I think that's a very good question. The African Union Commission and the African Union have had extensive discussions on this. And actually the Bureau of the Ministers of Foreign Affairs, what they call the Executive Council of the African Union, has actually debated this and came out with clarity in terms of what we should actually be doing with member states there. I think they call it vulnerable populations and the risky population. That will include refugee camps and then those the slum cities around many capital cities. It's not just Kenya. It's very clear, as I said, that we have to divide this into two. One is what do we do around those slum cities around Johannesburg or Nairobi or Yaoundé. I think it's clear that, as I said earlier, that this has to be a community-led and a community-owned response, which we tailor the messages to the community, create community champions and leaders that will guide us into the basic understanding of how to fight this in the community there. It cannot be only public health-led. Public health alone will fail in those communities. There has to be a strong sociological component associated with public health practice to succeed in those communities. There's absolutely no way you go to those communities today and you tell them that, 10 people cannot sleep in a room or in the same living quarters. It's difficult. I think we have to admit that we have to contextualize our social distancing or physical distancing, as we've pivoted to, in the context of what the countries are. And we are beginning to see that it's a challenge. Even the lockdowns are a serious challenge for the countries. So many countries in Africa are already beginning to witness situations where the community and population are saying, look, we cannot live under these conditions any further. Something must be done. We just noticed that Ghana has moved forward with lifting up the lockdown. We know that there's challenges in Nigeria just because of the kind of populations that you described. On the one hand, there are areas that are inherently insecure. The Peace and Security Council of the African Union is discussing that, and interestingly. And just today at the Commission meeting, that was a big focus of the debate. And I believe that they will continue to discuss and provide directions and guidance to countries as to how to handle or conduct themselves in those scenarios there. So I think those are two very challenging circumstances that no one has the answer yet, but we have to frame it in the context of local ownership and local leadership of those responses.
Thank you. We've had some questions come in about work with the WHO, both your work with the WHO in Africa, but also what we think the likely effect might be of the announced U.S. Cessation of support right now, or suspension of support to the WHO. I want to ask you both first what role the WHO is playing to support your efforts at the Africa CDC, and then also to Ambassador Le Pen, what can the U.S. be doing to get around and to manage what is a very difficult situation globally, and perhaps for reasons that are political outside of our immediate response. But how do we mitigate any potential negative effects of that political conflict that's going on well outside of Africa? Maybe Dr. Nkengasong, I can ask you to respond first.
Yes, I think our relationship and coordination with WHO has been very strong. I think very early on February 22nd, as you alluded to earlier, we had a meeting here which was convened by the chairperson, Musa Faki Mohammed, and brought together all ministers of health. WHO Afro Regional Director Dr. Moeti, a longtime friend and colleague, was in attendance. Dr. Tedros, the Director General of WHO, called in by video. So it is from that meeting that we developed a continental strategy, which has been endorsed now at the highest level of the continent, that is at the level of the head of states. I think that is one, and we continue to exchange very freely. And the task force, what it's called the African Task Force for Coronavirus Preparedness and Response, has participation across the WHO EMRO and WHO Afro into the technical working groups there. I think we continue to enjoy that kind of exchange there. Now, with respect to the specifics, Dr. Moeti and I, as you probably know, I'm also an envoy, a special envoy to Dr. Tedros on COVID-19 for Africa, one of the 3 envoys in Africa. So through that mechanism, we stay in touch very closely. We coordinate our efforts very closely. Give you an example. Just last night, Dr. Moeti, the regional director of WHO, sent me a WhatsApp message saying, look, and send me some pictures of elections taking place in the country and where there was a large rally and said, look, this is going to only promote the transmission of COVID-19. Can you take it up at the commission? And today at the commission meeting, that was central. I mean, I brought that squarely to the commission for a debate and discussion on what the African Union's position should be with respect to countries planning elections. And so that's the kind of relationship where Africa CDC, because of its unique location within the African Union Commission, has access to the highest leadership of the continent, that is at the head of states level. The WHO offices have relationships with strong relationships with the ministries of health. But if you combine that, it gives you a strong synergy at both the policy level and strategic level in respect to supporting the countries or articulating policy issues and guidance to the countries there. So I think that is so far we continue to ensure that we strengthen our coordination, communication, and cooperation during these very challenging times.
So on WHO, for now, the administration is undertaking a review. We expect it to be 60 to 90 days in duration, and including the full interagency, including State Department. And so assistance suspended for that period while a review of WHO is conducted. And the intention during that period is to ensure that we continue to provide assistance to Africa, that there is no halt or delay in our provision of assistance. Can I pick up on one thing that wasn't your question, but that Dr. John mentioned, though, if I could, which is on the political structure that he referenced, because I think it's a really important issue that's worth putting out as a frame for all of the activities that are taking place. And I've been really struck by how extraordinary the political level response to the pandemic has been and how quickly that happened. So what you have seen is really a political coming together and a transnational response. And you can say, well, of course, you've got a transnational threat. Clearly, you need a transnational response. But I actually think that doesn't allow sufficient credit, because in the context of this threat, the instinct is, roll up the borders, close the airports, and in fact, relatively quickly, there was a pause in that approach, and very much driven by heads of state. And instead, they have really organized and integrated under the continental strategy that Dr. John referred to. And the execution of that, I think, is very notable. So you have some 9 heads of state who convene every other week under their auspices, the ministerial committee that Dr. John referred to, which meets weekly. So there's the political level and the technical level that is relatively integrated. And consistent with this is also a Africa-wide fund for COVID response that the AU has established. And the sort of secretariat function for all of those activities is really Africa CDC. So you've got a connectivity that is, I think, to be lauded between the political and the technical levels. And as I say, one might think, of course, that kind of structure is required, but I think it's really challenging, and it means that you've got a consensus and a coordination that is head of state driven.
Thank you.
I think let me just say a few lines to supplement what Ambassador Le Pen just said. I think I've never seen such coherence and adherence and support at the level of the head of states. I think we do brief them every 2 weeks, and at times it's weekly now. The last briefing was last Wednesday, and the next briefing will be tomorrow. So, and the discussions are very lively and very engaging. I think, thanks Ambassador Le Pen for highlighting that, which is an extraordinary political commitment and will to supporting the fight against the COVID-19 on the continent.
We've had a number of questions come in about PPE, ventilators, testing equipment, and whether or not Africa CDC is getting enough of the equipment that it needs now and will need into the future. I wanted to ask that in basic terms, but also inquire about the appointment earlier this month by AU Chairman Ramaphosa of a team of special envoys, African special envoys, to help solicit concrete support internationally from partners outside the continent. What role are they playing? And are you coordinating this overall effort to obtain the necessary technical equipment with them as well? And then again, what to Ambassador Le Pen, what if anything can the U.S. do on this front to support the provision of technical assistance and actual equipment? We've noticed, our own president has indicated that there might be equipment forthcoming to Africa. What does that assistance look like right now? So to both of you.
So let me take it, go first. Of course, we do not have enough of what I call commodities to support the spectrum of response. That is being from the prevention of transmission to the prevention of deaths or the harm. But so we continue to scramble because this is an unprecedented situation where the whole world is fighting the same enemy, and with the limited commodities that existed. For example, the world used to test about 400 million tests, say in a month or so, but now we are doing such testing only in a couple of weeks, and so there's bound to be huge challenges in access to those. So that has been a challenge and continues to be a huge challenge for our ability to respond. Now, with respect to the Envoys, I think President Ramaphosa has done an incredibly important thing of aligning top experts, economists across the continent with high standing reputation and incredible achievement to support this struggle, because they have a coordinated approach. It's not just a committee for ministers of health. We also have a coordinating committee of ministers of finance and ministers of transport. And last week's coordinating meeting at the head of state level was very revealing. He did bring together the top business leaders across the continent, including the likes of Dangote, Stripe, Masura, and others, and then the Envoys there, so that we had a joint meeting. The importance of that is that some business leaders took on the challenge that they would help unlock the supply chain management system for the continent there, which is something that we really look forward to happening, and they have since engaged in a series of discussions to facilitate that move. There's also a private sector arrangement that will come together and see how the private sector can support these efforts across the board. So then you have the special envoys that they are all working within the multilateral bodies and the bilaterals to look at Africa's economic impact and the relief that is required to move the continent forward. And so I'm very pleased with the whole of society approach that the EU under the leadership of President Ramaphosa has actually used.
I was going to say something similarly enthusiastic on the envoys. I think, given the background that 3 of the 4 were finance ministers, they're going to play a really important role in terms of bridging all of the issues, the mix of public health and the mix of immediate financing needs and longer term financing needs. And so we've already been in touch with some of them and look forward to continued engagement with them to see what they're doing, and have conversations with them about where the U.S. can contribute from both significantly USG, but also U.S. private sector, which has an important role across the continent. On the issue of technical assistance and equipment, we absolutely are continuing to provide technical assistance and expect that will increase. On the question of supplies, as the U.S. increases its own production capacity, the expectation is certainly that we will be able to provide far more assistance, and I think we've publicly committed to do so, which is so important. At the same time, we're encouraging, where it makes sense, where it's feasible, local production as well.
Thank you both. I wanted to go back. We've referenced a couple of times the Ebola crisis in 2014, but I'm curious to know, Dr. Nkengasong, whether or not you're seeing in those countries which were frontline in the Ebola crisis 5 or 6 years ago, whether they have internalized those lessons learned from that episode and are responding any better, or are responding with any greater alacrity now in the face of COVID, or what other lessons learned have Africa CDC been able to take from that specific response to try to apply to other parts of Africa?
I think that's a very good question. When you look at the 3 countries that were heavily affected in West Africa, that is Guinea, Conakry, Liberia, and Sierra Leone, and on daily basis in touch with Liberia and Sierra Leone, you see that there's a huge political awareness that of the danger that this disease poses to the security and the well-being of the people. Remember that after the Ebola outbreak in West Africa, all 3 of them established their national public health institutions that they have been using in this current pandemic or struggle to coordinate their efforts and fight the outbreak. Just last week, we shipped hundreds of thousands of tests actually to Liberia and to Sierra Leone, and they're doing it themselves. Absolutely, that is a very, very good sign that I mean, they don't need extra assistance for people to fly in, but they just need the test kits, which we are making all efforts as Africa CDC to support all of them. As I indicated, our goal is that in the next 5 weeks or so, we roll out more than 1 million tests across the continent to increase the testing, the access to testing there. So we see that there's leadership at the national public health institutions in those countries, not just in Liberia and Sierra Leone, but in Guinea, Conakry as well. We see that there's political alertness to responding to that, which I think I can only attribute this to what the experiences, the very unfortunate experiences that we saw in 2014 in West Africa.
Great, thank you so much. I wanted to follow up. We've had a number of questions come in again on the supply chain of tests and where you hope to be getting your tests from. There's been a lot in the US media about the Jack Ma Foundation and Chinese contributions of testing in Africa, but where else are you relying on for your tests? And is there any sourcing of tests domestically within the continent right now?
That's a very good question. There are three sources of tests that we are looking at carefully. We, just as WHO is doing, working with groups in Europe that are producing what you call in-house tests, which is, those means they're producing the reagents and shipping. That's where the 1 million, we've ordered 1 million tests from a company in Germany, which has been supplying us the tests since the beginning of this outbreak. Excuse me, and it's the same company that has been producing tests for WHO as well. So we have a common supplier there. The challenge with using such a company is that, of course, they cannot meet up the request that is coming in from the continent and across the world. The second source of tests that the continent has received massive support is through the Jack Ma Foundation donation, which, as you probably will recall, in the last 4 weeks or so, they were able to distribute to the continent about 1 million tests and about 20,000 tests per country. And Africa CDC was instrumental in the distribution process. As we speak today and tomorrow, another shipment of 500,000 tests will be coming from the Jack Ma Foundation in a bundle that will include the extraction reagents, the test itself, and the swabs. So I think that is also going to be a huge relief for the continent. The third source of tests that we are looking at are those we call commercial manufacturers. And there's a task force that is in Geneva working on this together. Africa CDC participates, and they are looking at those groups like the Roche, the Abbott, and the Cepheid for Cepheid for point of care testing. So I think we will be working and hoping that that process can move quickly so that Africa can have access to the appropriate quotas to build up their testing. So those are three different parts of diagnostics that we are relying on to move forward as quickly as possible. But again, it's a challenge. We are very low as we speak. I mean, with almost less than, I'll say, 600 tests, 600,000 tests, excuse me, on the continent, which I believe is still minimal for now.
Yeah, I wanted to pivot and ask you a little bit about the social distancing efforts that are being promoted in and across Africa right now. Places like Ethiopia and Uganda have more than 80% of their populations going to weekly church services, and we have seen in places like Nigeria and Senegal and Sudan recently protests when mosques were closed on Friday to try to enforce social distancing. We've seen other places where the army or the police have met protesters who were under lockdown with violence. It seems like, I mean, we're 6 weeks or 7 weeks into our shutdown in the United States. what are you counseling to African nations right now who are faced with a shutdown and faced with societies that are both not used to social distancing, but who may not have the coping strategies, either the money, the financial savings to withstand a long-term shutdown, or other access to coping mechanisms? How are you counseling them on shutting down their cities and their economies for long durations?
I think that is a very important question. There are two things that we are counseling countries. The first is that you really have to engage your community. This is not like turning on electricity in your home and turning it off. I think, you have to engage your communities, have a dialogue with the communities, educate them, inform them, and do that on a regular basis there. I was very pleased just the other day when the president of South Africa addressed the nation and was appealing for more patience from the community to cooperate more so that they can actually get the job done. I think you need regular engagement there. It has to be a process, not an event. I mean, meaning that it's not enough to just make a one-time TV announcement from the head of state or the leader of that country, and then because the effects are damaging. We have to recognize that it really plays into the core of the social systems that drive the continent, and the behaviors and belief system, like closing down places of worship that people adhere to very strongly. I think that is one thing. Second thing is that advice has been that this has to be done with human rights and dignity at the center of this. I think we strongly condemn and discourage use of force or excessive force in trying to implement the lockdown processes there. It has the security apparatus has to treat people with dignity. They must engage the community and build a relationship with the community there. I think, again, human rights has to be at the center of this as we do it, especially if we're doing this for the long haul. So those are the two things we've done to communicate with the countries and make sure that we do this squarely and repeatedly to the governments of member states.
Can I ask a follow-up to that? Because Africa, actually not unlike the United States, has important elections this year. And elections are a time where there are rallies and where there are people queuing for sometimes very long periods. What conversations are going on with heads of state at the African Union about holding elections in Africa this year? We've seen that Ethiopia, I think, was probably the first to delay its election this fall. Are other countries considering similar kinds of efforts to maintain social distance, or have you not gotten there yet?
No, we have actually. As a matter of fact, that is something. As I said earlier, just yesterday, Dr. Moeti, the WHO Africa Regional Director, sent me a message with some pictures from a country that had organized a rally, a political rally, and that became center stage. That took center stage in my discussion today at the commission meeting, which I said, look, we have to advise you as a technical lead of a technical agency that if these gatherings are continuing to take place, you see an outburst of COVID-19, and that will undermine all the efforts that we are putting on the continent. That discussion and debate is going on through the Commission of Political Affairs. And I think the Peace and Security Council of the African Union Commission will also be debating that as well. And that would ultimately lead to some guidance or policy recommendations to countries that plan elections this year. So that much is very, very high on the Commission's agenda.
Thank you. In a related point, I think one of the questions that has come in repeatedly here is about public education. And we here in Washington and around the world with access to this feed have access to information, but many populations in Africa don't have access to good information about how they can be preventing this. And there's also misinformation. There's an abundance of misinformation about this disease right now. How are you going about combating both the lack of information and the misinformation about what might be working? We've seen in African media traditional remedies perhaps being promoted in various countries. How do you combat that and respond to both of those misinformation and lack of information around this virus?
I think what we are seeing with COVID-19 is not different from whenever you have an outbreak, a disease outbreak. I think that's why we have been even before this outbreak, we have been very insistent that we have to reimagine the way we approach response to diseases and bring social sciences to the fore, as well as risk communication there. I think that is clear. When it's ever a threat and human behavior, we just don't, we react in different ways. I think we have to always factor that in. So, but very precisely, we do host a weekly press conference with the media, and we use that opportunity to engage and build a relationship with the media and make sure that they assist us in providing the right information out there. It has to be in a strong partnership with the media to address that. We have the social media, which is a very important source of information for most people, for a lot of the people. Yeah? And it's amazing how people tend to forward things that are completely not accurate at all through the different networks. I think we are developing platforms within the African Union Commission with some support from the GIZ, the German corporation, to combat such information, including a partnership that we are developing with other groups that will really target the community and make sure that we counter that kind of information with good information. Then, of course, it's our website. Each time we guide people, the continent, towards our website or the website of the World Health Organization. So it's a complex problem that is also emerging because of the way information is processed these days and the way social media has taken prominence in this. I think one of the lessons that we learned from this when the COVID-19 will be over is actually how do we strengthen our approach with respect to countering fake news or misinformation to fight the disease outbreaks in future.
We've had a couple of questions asserting different arguments coming in from participants, with some asserting that that there's a very low ratio of those being tested positive, while others suggesting that the testing rate is going up in terms of positive findings. What is the right answer there? Are you finding that Africans that are being tested and coming out negative at a higher rate than in other parts of the world, or they're having a higher positive rate than other parts of the world?
Well, no, I think the discussion we've been having at the coordinating meetings of ministers of health is how to improve our yield. And so the challenge countries are having is that you test 800 people and you find two cases. I think so. The question becomes: do we have the right tracking or targeting the right population there? And don't forget that this is some countries, I would say, are beginning to experience a large community transmission there, which means you really have to find the cases and as much as possible. So I think we expect to see large testing with low yields, but which is important. Even if you isolate, if you do 500 tests and you identify 5 people or 2, and you do the appropriate thing, which is to isolate them, trace their contacts, and do additional testing there, that is still a very important return on your investment. So I will not minimize that. But overall, we've seen that across the board, that on the one hand, countries like South Africa are doing an aggressive testing and seeing a large number of cases. And on the other hand, countries like Ethiopia and others are doing large case testing or large amount of testing, and the yield is not as high as we would expect.
Right. I appreciate that. We've had a number of questions come in about public-private partnerships to augment the work that you are doing. Ambassador Le Pen mentioned some U.S. firms which have had a long-standing presence in Africa with respect to the PEPFAR initiative, malaria initiative, various other U.S. medical initiatives. What has been the response from the U.S. private sector and the global private sector? We've seen, again, some Chinese and European companies stepping in to try to fill the gap. But again, this is a global pandemic. And so many of these companies are producing testing and PPE for their own domestic markets. So what is the bandwidth for companies like an Abbott Labs, for example, which has been touted in the United States as potentially producing a quick responding kit, a test kit? What is the conversation like with those companies about augmenting your access to needed supplies right now?
I think our engagement with the US-based, I would say, diagnostic company is through the task force that I indicated, which is coordinated out of Geneva with the World Bank, UNITAID, UNICEF, WHO, and others. I think that is the platform that, that with the Clinton Health Access Initiative at the center of that, trying to help with coordination. So I think that's our platform or the interface with those companies in the US. But we really hope that that process will very quickly be coordinated more from the continent. I think that is the mandate we've received from the head of states to say, look, we have to own this and lead this process itself. So I think we are hoping that once we get our numbers right, we'll engage a dialogue that will be orchestrated within the continent, of course, in collaboration with what is going on in Geneva. So that's as far as we have engaged, and then on more direct bilateral basis there, the Africa CDC is in discussions with the leadership of CEPHID to understand how we can provide us direct support, because the point of care test that has been developed by that company will be a game changer if large amounts were to be available for us to scale up the testing, especially in areas that you just indicated, the remote areas, the more vulnerable areas like the slum cities and around the capital cities there. So I think that discussion is ongoing, but again, our desire is to see much coordination with the US companies that are manufacturing those tests happen on the continent.
Cameron, can I add one piece on the US private sector? Because I think what's exciting and potentially really important is that the collaboration from the private sector will be not only in the diagnostic space. And interestingly, Dr. John and I spoke about a week and a half ago to the members of the US Chamber of Commerce and the Corporate Council in Africa. And there were over 200 US companies who showed up for that conversation. And in many ways, the premise of the conversation is, what's the space for public-private partnership? And I think that there will be quite a lot, because as we've talked about, there's the health and medical channel. There's also the economic, the immediate and the recovery phases. And so I think US companies will play a significant role and want to. We're seeing a lot of response from US companies in South Africa and also within West Africa. And from my perspective, that follows on a really important dynamic over the last year or so, which has been the increasing engagement of US companies with the AU in the context of the African Continental Free Trade Area. So a whole set of relationships that were really new had begun to be built out. Obviously, they were going in a particular direction, but those relationships are still there. And I think what I'm hearing is a lot of interest from US companies in being part of the solution.
And let me just add that, the US companies like the Becton Dickinson, the Abbotts, the Roches have a strong interest to partner with Africa CDC, because the instruments that have driven the diagnostics for HIV and TB over the years thanks to the PEPFAR effort and the President's Malaria Initiative and others, are there. I mean, we just need to build on those systems and instruments to expand testing and scale up testing across the continent. So I think I'm really looking forward to that dialogue with those companies that do manufacture diagnostics and that have supported us in the HIV, TB, and malaria efforts.
We're coming short on our time here, and so I want to be respectful of both of your schedules. But I wanted to end both to hear where are the countries that you're most concerned about right now, the countries that have the highest rate of community transmission right now, that you are really nervous that if we don't get a handle on quickly, it could be catastrophic for those countries. And then conversely, I'm curious to know, what are the bright spots out there, and what are the countries that you can hold up as an example, not just in Africa but globally, as both having responded early and effectively to this pandemic?
I think let me focus on the continent. I think South Africa has a good story going on, a beautiful story going on with the aggressivity in which they've approached the testing and tracing there. I think using mobile laboratories and going around the country in a very, very aggressive manner there. I think that is a very good initiative. Ghana is beefing up, is using innovation, drones to move specimens from different parts of the country to be tested at a few sites that they have. I think those are some very good success stories there. Now, with respect to the concerns, of course, Africa is a large continent with 55 member states, and they're all at their different levels. But to just very broadly say that I worry about the entire continent, I think that has to be very clear, because of our systems are fragile. If this outbreak or pandemic would take up the way it's taken up in the United States and Europe, it will be a serious challenge for any country that I can imagine in Africa. Underneath that, you have two sets of countries. The one are the big countries in terms of population size. That is the Nigerias with 200 million people, Ethiopia with 100 million, DR Congo with about 90 million people, Egypt. I mean, that is, when you talk of public health practice, there's only three things. You talk of the population, the pathogen, and the policy. So if you have a large population and you have a pathogen that is spreading in those large populations, there is a threat. It offers a huge threat, not just for the country itself, but for the entire continent. Then the last set of countries are those what I call extremely weak and fragile, unstable countries that are just either emerging from conflicts or are actually witnessing active conflicts on the continent there, which you alluded to earlier, or the whole belt in West Africa, where the northern part of Mali, Burkina Faso, and others, where you have and up to Cameroon and Nigeria, with Boko Haram operating in there. Those kind of very unsecured areas there, I mean, are difficult to implement any meaningful public health outcomes there. We saw what happened in DRC, in Congo, with Ebola. That has taken us more than 2 years in that context, not because we don't know what to do. I think we had almost the best tools to fight Ebola in the DRC, but because of the insecurity, the outbreak drags on forever. So I think these are three categories of the concerns that I have for the continent.
Thank you. We've run out of our time allotted for our conversation today, and I know you both have very busy schedules. You're both joining us from Addis Ababa, and we had a great connection today with you. I'm so grateful that you took the time out to help this audience understand both what we as Americans can be doing to be supportive, and our government can be doing to support your really heroic efforts to try to get a handle on this. I think the message that I've taken away from this conversation is partnership and the value of partnership in combating and confronting the pandemic, both in Africa and in the United States. And I think that we're going to have a lot to learn from each other as this unfolds. And so I thank you both for sharing your expertise and being partners with the Atlantic Council today in this conversation. So I wish you both Godspeed in your work, and thank you very much for joining us.
Thanks so much for having us.
Thank you. It was a pleasure.